team, the patient presents with orchitis, ponovitis, and arteritis. What's our diagnosis?
Could it be Boucher's disease or maybe even Koyanagi, Harada syndrome?
I think it might be granulomatosis with polyangiitis.
I'm leaning towards Takayasu arteritis.
It could also be juvenile idiopathic arthritis.
No. You're all wrong. It's hyperecplexia.
But Dr. Hawks, those are neurological symptoms, not what we were thinking.
I don't care what you were thinking. Now listen up. We need to perform list of ectomies on the patient.
But Dr. Hawks, that's a risky procedure. Are you sure it's the right course of action?
I didn't ask for your opinion, Leslie. We're going ahead with the list of ectomies. Now, scrub in. All of you. We've got work to do. Tracy, you called me in here for what now? I need to perform a series of ectomies on my patient with suspected hyperecplexia.
Hawks, I thought I banned the list of ectomies being used as a procedure.
You can't ban a procedure just because you don't like it. That kills people.
No, I'm saying that every single time you've required your doctors to perform a non-specific list of ectomies on your patients, they unsurprisingly do not get better.
It's possible you hired some real idiots at this hospital. Maybe ban idiots. Just a suggestion.
You have no idea how long I've wanted to ban you from this hospital.
I don't really care. You seem to have attachment issues and just keep me around like some sort of sick drama TV show that is long declining in viewership.
That doesn't make any sense.
I know, and that's why I'm ending this conversation. I am ectomying myself from this room because I still care about my patient. Have fun fantasizing what season finale hijinks I get into? Bitch.
It looks like the patient is in critical condition. We need to act fast.
Well, that's unexpected. It seems like the list of ectomies was not the right approach for treating hyperecplexia, despite what Dr. Hawks suggested.
We can't dwell on that now. We need to figure out the correct treatment plan. What do you think we should do?
We must unectomy the patient.
Oh, not this invent a new word crap you keep doing. It's about as effective as what Hawks initially suggested.
Okay, then I guess we'll need to talk to Hawks. Maybe he has a better idea.
You imbeciles nearly killed our patient with your incompetence. Hyperplexia was a misdiagnosis and performing a list of ectomies was downright irresponsible.
Hawks, what do you think the correct diagnosis and treatment is then?
Yeah, we need to know how to treat the patient properly.
Somehow don't think whatever I'm about to say even interests you, sad sex.
Please enlighten us, Hawks.
We're all ears, Doctor. What's the real diagnosis?
That's my problem. You're all ears without functioning eyes, hands, legs, or even brain cells, for Christ's sake. Everything I say goes into one ear and straight into entropy.
Black holes don't fit inside people's heads, Hawks.
That's unrelated to entropy, Gary. I'm not surprised you have no clue what you're talking about regarding literally anything. I don't have time to educate a bunch of incompetent fools like yourselves. Figure it out or get out of my way. So, how are things going in the oncology department, Johnson?
Pretty good, actually. Most of my patients are responding well to treatment, which is always a good sign.
That's great to hear. I've been dealing with this one case that just doesn't add up. It's been consuming my thoughts lately.
Oh yeah, what's going on with your patient?
I can't quite put my finger on it, but I feel like I'm missing something important. It's like a medical mystery that I can't solve.
Well, you'll figure it out, Hawks. You always do. Just keep digging.
I think I've got it. Johnson, excuse me, I have to go. I know what's wrong with my patient.
Wait, Hawks, where are you going? What about lunch?
Check back with me in 3 days. If it isn't out by then, call emergency services. I've figured it out. It's Machado, Joseph disease.
What's going on, Hawks? Why aren't you wearing the proper gear?
You can't just storm in here like that. Hawks, it's a sterile environment.
What about the patient's well-being? Wait, why are you all dressed like you're in an operating theater?
Our jobs now require us to act like actual doctors who wear proper equipment.
The hospital budget let us get new uniforms. Now where's yours, Hawks?
No time for that now. Hyperecplexia was a misdiagnosis. Machado. Joseph disease fits perfectly. Unfortunately, it's a progressive degenerative disease with no cure.
You solved this during lunch with Dr. Johnson?
Yes, we put our heads together and cracked it.
Like the eggs that went into your sandwich. Or like the street name you labeled that substance you smoked this afternoon before coming up with Mikado. Joseph disease?
That's not a nice allegation, Randall. Hawks doesn't smoke crack.
Frank, for the last time, you don't snort it, you...
Can all four of you shut the hell up and get this patient out of this operating room? They're about to get the worst news of their life, which does not have anything to do with the fact that they were diagnosed at the 9th best hospital in the Tri-County area. Thanks, Tracy.
You did a great job catching that. It's important to admit when we make mistakes and to learn from them.
I didn't make any.
You misdiagnosed them earlier.
No, I just had a secondary diagnosis call before we found the primary diagnosis.
You're gaslighting me.
Sounds more like you are.
Are you seriously putting this conversation in an endless loop to just avoid taking responsibility?
No, I think you're doing that. I shouldn't even be here this late in the day.
It's noon.
That's what your clock says. Mine could be different.